My name is Dr. James Petrelli. I am a physician practicing in Connecticut. I'm a patient here at MedWell. I was diagnosed with peripheral neuropathy approximately 4 years ago, but the symptoms in retrospect had gone on for 6 years. I talked with my neurologist. I even saw a specialist up in Boston who had the same recommendation. Just take your pain medications and make the best of it. And it came down to I was taking more and more medication just to chase the pain, just to be borderline functional. I was worried where this was going to lead because my neurologist was talking about tramadol, which is an opiate, and I did not want to go down the opiate road per se, because I've seen it both in practice and in family members what that can do. It's a slippery slope, and I refuse to go down that. Everyone here is wonderful. They're more personable. And most of the other places I looked at were only doing fat cell, adipose mesenchymal cell transplants, which I agreed with Dr. M. I don't think are appropriate, that it has to be a fresh line. So I came here. I underwent the treatment for my neuropathy in my feet, which is my worst area. About a week later, I noticed a strange sensation in my feet. I'm not saying all my symptoms disappeared, but I felt something funny, kind of a tingling feeling. And now it's been 3 weeks out, and in the last week, the pain has gone down to my feet from probably, when it's at its worst, at 8 out of 10 to maybe a 2 out of 10. And it's continuing to improve, with now the only real pain I'm having is in the tips of my toes. But I've also noticed now that I'm starting to get some degree of mild sensation back in the soles of my feet, where the numbness and pain had been the worst. So I'm returning today because I'm absolutely amazed with the success that this has had to have my hands injected. Again, this has been amazing for me. I've had a response to this treatment that has far exceeded my expectations. To point out that I may not have mentioned, as far as the medication goes, I've decreased the amount of medication I'm taking on a daily basis dramatically. Not only have I decreased it, but when I do need it, the medication seems to work far and above what I had before. The effects are quicker and longer lasting. So on that front, the amount of medication I have to take or had to take has decreased dramatically also.